Hello, Ms. Smith. My name is Michael Phillips. I'm a student nurse at the University of Southern Mississippi. Can you please confirm your name and date of birth? Alright, that's correct. I checked you on your wristband. Thank you. Do you have any allergies that you need to tell me about? No allergies? Okay. Well, today we will be inserting an NG tube. An NG tube is used for nutrition, and I will begin by inserting it into your nose. Once it reaches your pharynx, the back of your throat, then I will hand you a glass of water for you to sip as it goes down. It'll help it go down your esophagus easier. And then, once it reaches your stomach, we will send you to get an x-ray to confirm the placement of the NG tube. And then you'll come back and it will be ready for use after I remove the wire from the NG tube. And I'm still getting my equipment ready, so if you'll be patient with me, Ms. Smith. Well, Ms. Smith, if I can almost have it. Right. Now, after I get my gloves on, I'll measure the NG tube for how far it needs to be inserted by beginning at your nose, measuring to your earlobe, and then measuring from your earlobe to your xiphoid process. That will be how far, and then I will mark that area, and that will be how far we inserted. Before I do that, I'm going to check your nares for patency to see which nostril we will be inserting the tube into. Alright, will you breathe in deeply for me? Thank you. Thank you. Today we will be using your right nostril. Now I will be measuring before I measure the tube, I'm going to lay this mat out across you, just in case we have any fluids come up, so you'll stay all dry and clean. Now I'm measuring from your nares to your earlobe, and then from your earlobe to your xiphoid process. Alright, thank you. I'll mark this area. I'm going to lubricate the NG tube 2 to 4 inches. Alright, now that it's lubricated, I will begin the insertion. Alright, I'm going to need you to tilt your head back as it goes through your nostril. The insertion has begun. Now, if once I reach your pharynx, if you begin to gag at all, then we will stop and let you gather yourself, and then we will begin it again, but we have to finish it. But if for some reason there's any indication that it has gone into your lungs, you begin coughing, choking, anything, then I will remove the tube and we will begin it, and we will try it again later. Alright, so now I'm still going through your pharynx, or your nose. Alright, I believe it's reached your pharynx now. I'm going to hand you this cup of water, and I'm going to tilt your head forward. If, please, Ms. Smith, you'll take a sip with me on the count of 3, and the sip will help it go down easier. Alright, 1, 2, 3. 1, 2, 3, sit. 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 Okay, so now that has reached your stomach, I will tape it off. Alright, now that the NG tube is taped to your nose, we will send you to get an x-ray to confirm that the NG tube is in your stomach. Okay, the x-ray has come back. It is confirmed that it's in your stomach. Now I'll be removing the wire so we can use the NG tube. Alright, Miss Smith, you no longer need your NG tube, so I'll be removing it now. I'm going to need you to hold your breath as I remove the NG tube to prevent any stomach juices from going into your lungs. So hold your breath on 3 and I'll be removing the tube. 1, 2, 3. Keep holding your breath, keep holding your breath. Okay, thank you. I'm going to clean up my station. Thank you for your cooperation, Miss Smith.